promptly We'll get started promptly at the top of the hour, so in just a few minutes. In the meantime, please be sure to select a language using the interpretation button at the bottom of the screen. You'll see options for English, French, and Spanish. Hello, everyone. For those of you who have just joined us, we will be getting started in about 2 minutes. In the meantime, please be sure to select a language using the interpretation button at the bottom of the screen. You can choose from English, French, or Spanish. And please do introduce yourself in the chat box. Hello, everyone. We'll just wait a few more seconds for others to join us, and we'll get started in just a minute. If you haven't already done so, please be sure to select a language using the interpretation button at the bottom of the screen. You will need to select English, French, or Spanish as one of your languages. And as we get started, please do introduce yourself in the chat box, and we'll get started in just a couple of seconds.
Morning, Linda.
Good morning, young Ron.
You're up bright and early.
Oh, but of course.
Great, we'll go ahead and get started then. Thank you everyone for joining us today. Welcome to the second roundtable on advocating for WASH in healthcare facilities. Please be sure to select a language using the interpretation button at the bottom of the screen. And as we get started, please introduce yourself in the chat box by sharing your name, your organization, and where you are currently located. I'm Danielle Heiberg, Advocacy Advisor with Global Water 2020, and I'm excited to have you join us for today's discussion on advocating for accountability. We'll start the session with a few short remarks, but the majority of the time is an open discussion so that you can share your own experiences, ask questions, and learn from each other. Before I turn the discussion over to the facilitator, a few logistics. The webinar is available in French, English, and Spanish. By now, you should have already selected your language using the interpretation button at the bottom of the screen. To help the translators, when speaking, please be sure not to speak too quickly. And from time to time, comments may be repeated in English to facilitate the translation. The webinar is being recorded and will be available in all 3 languages on Global Water 2020's YouTube channel later this week. Please use the chat box for comments, reactions, and questions. If you would like to speak during the open discussion portion of the session, you will need to use the raise the hand function and wait to be called on. And now I would like to introduce the facilitator for today's discussion. Lindsay Denny is the health advisor at Global Water 2020. She previously served as a manager for Emory University's Safe Water in Hospitals program. Additionally, she has developed WASH training for healthcare workers and cleaners, conducted research on WASH in healthcare settings, and advocated for the improvements in WASH in healthcare facilities at the national and global level. She has visited facilities in Ghana, the Philippines, Rwanda, Cambodia, Malawi, Zambia, Ethiopia, Afghanistan, and Haiti. And over to you, Lindsay.
Good morning, good afternoon, good evening, all. Very excited to be with you. It's always fun to be with the community of practice and to be speaking with old friends. So today we'll be talking about advocating for accountability. For those of you who joined us 2 weeks ago on our first session, we talked about what it was to advocate for WASH in healthcare facilities. What are some of the challenges and what are some of the approaches that our different partners have used over the years? If you didn't have a chance to join us, there is a recording of that, which we can share in the chat box. But in today's session, we'll explore how we can direct that advocacy to an important element of WASH in healthcare facilities, accountability. We'll hear from veteran WASH implementer and advocate, Dr. Brima Apabere, as well as advocates across the globe, and we'll have ample opportunity, as Danielle said, for discussion. But first, let's talk about what we mean by accountability. Certainly, we all have different definitions of this, but for the purposes of this session, we'll be discussing accountability at the national and sub-national levels within governments, with a focus on holding governments accountable to ensuring that all healthcare facilities are equipped with WASH services. And this in particular links back to the World Health Assembly resolution from 2019 that many of you are familiar with. We recognize that other mechanisms of accountability may exist, and that may engage other stakeholders like healthcare workers, facility administrators, and community members. However, that's not the focus of this particular webinar, though we recognize it is an important element of our work. We also realize that accountability comes in different forms, some more legislated than others. They may include monitoring systems with feedback loops and regulations. There may be incentives, including financial incentives for healthcare facilities to reach basic WASH services. The Ministry of Health may have licensing and accreditation in place for these healthcare facilities. There may be certification processes or even competitions or national ranking systems. Whatever the system is, when we talk about accountability mechanisms, we are asking ourselves really, who is accountable, to whom, for what? It is important to understand who are the gatekeepers, either people or institutions, and what motivates them. In terms of WASH and healthcare facilities, it is important to remember that we have this document, the 8 practical steps. If you're unfamiliar with it, it was launched by WHO and UNICEF a few years back, and it lays out the 8 steps that governments should take to achieve basic WASH services in their healthcare facilities. In general, it's sort of an overarching framework that we can hold countries accountable to, but even within it, step 3 calls for countries to have standards for WASH and healthcare facilities and accountability mechanisms in place to ensure standards are implemented. So all of this to say is, we as advocates have an opportunity to use this framework to hold the countries accountable to ensuring that WASH services are delivered. So today we'll focus on how advocates are actually taking action on this. What are the opportunities? What are the barriers? And we want to hear from you all about what are experiences you've had, and discuss how we can move forward to making sure that this is part of every advocate's agenda in WASH and healthcare facilities. So now I'd like to turn it over to our keynote speaker, Dr. Brima Apambire. Dr. Brima Apambire is an expert in WASH, environmental and development issues with extensive field, academic, teaching, grant-making, advocacy, and management experience. He is currently the Senior Director of the Center for International Water and Sustainability at the Desert Research Institute in Nevada, where he conducts applied research and provides training and information to NGOs, governments, universities, and others in the WASH sector. He is experienced in integrating WASH activities into the development sectors such as health, agriculture, and education, environment, climate change, gender, advocacy, and microfinance. Previously, Dr. Apambire was the senior advisor and lead for the Safe Water Program at the Conrad N. Hilton Foundation, where he led the development and implementation of the foundation's WASH strategy. At the foundation, he co-led the Bill and Melinda Gates and Howard G. Buffett Foundation's development of a WASH advocacy landscape and strategy for the WASH sector. Prior to this, Dr. Apambire was a WASH director at World Vision. Dr. Apambire was born in Ghana, West Africa, and grew up in the northern and poorest region of the country. As a child, he sometimes walks long distances to fetch water during the dry season. He has researched and published numerous papers, articles, and reports on WASH issues in developing countries. He received his BS from the University of Ghana, his MS from Carleton University in Canada, and his PhD from the University of Nevada. Dr. Apambire, we're so happy to have you with us. Please go ahead.
Yeah, thank you, Lindsay, for the introduction. And good morning, everybody. It's 4 a.m. here in Reno, and I'm delighted to be part of this roundtable. And thanks to my friends at Global Water 2020 for putting together this important series of roundtables. It's very rewarding, to see how the WASH sector has come along. Many years ago, advocacy was around, increased funding, and in the whole country, in the whole world, to increase funding to the WASH sector. Today, we are now looking at increased funding, advocacy for increased funding, and effective programming in WASH in healthcare facilities, especially in least developed countries. Previous work in advocacy in WASH, started probably about 10 years ago. And I have some of my colleagues here, John Oldfield and others, we work together during WASH Advocates organization and Water Advocates. Water Aid was very instrumental in that. And we've come a long way that there has been increased funding to the sector, especially from the US government, where a lot of funding from US government went to just a few countries. but funding was redirected due to those efforts to least developed countries. I think the same momentum can be put around washing healthcare facilities. And I know all of you have the basic statistics about coverage. The situation is not very good. And as Lindsay indicated, the first round of talks was around advocacy for washing healthcare facilities. Today, our topic is advocating for accountability, which is still part of advocacy, but is very important. It's one thing having governments and funding agencies pledging funding, and then another thing really releasing the funds for the appropriate work to be done. So this is where advocating for accountability is very important in the work that we do. I often have an example from my own country, Ghana, when many years ago, it was known that the Ghanaian sanitation coverage was very, very low when WHO or UNICEF changed the criteria for defining what basic sanitation was. And they removed what we call shared latrines as not part of basic sanitation. And I remember Ghana rural water coverage came down to about 7%. And the government was looking at other countries that were probably not as developed as Ghana, having higher percentages. And the government immediately made a pledge of $200,000 into the sanitation subsector. And for almost the whole year, the money wasn't released. And people within the wash sector, could not, advocate for accountability. So this is one important area that I think in our sector we have to look at. But Lindsay already defined a little bit of what advocating for accountability is. So I will just add a few statements to it, since this is going to be an open discussion. I wouldn't want to, talk for long. But advocating for accountability calls for tracking the fulfillment of commitments by donors, international agencies, and governments. And accountability is very critical to achieving targets. And NGOs, civil society, community members play a critical role in this. As I already indicated, although governments have adopted policies and also have committed, to increase funding, we need to hold them accountable. The WHO and UNICEF states that, we need about $3.6 billion to be able to meet basic, wash services by the year 2030 in healthcare facilities in least developed countries. And yet we just have about 3% of the annual recurrent government budgets that goes into washing healthcare facilities. And even within the wash sector, we also just have 3% of funding that goes into washing healthcare facilities. So we have a lot to do as development workers in this area to effectively advocate for accountability. We also need to make sure that budgets are disaggregated so that we know exactly what is going into washing healthcare facilities. It's a very tricky situation because washing healthcare facilities, just like WASH many years ago, was an orphan sector because we looked at it as being a cross-cutting issue. It belonged to health, agriculture, and so many other sectors. But things are better now within the WASH sector, where in most organizations, WASH is treated as a sector by itself. WASH in healthcare facilities is similar now to that because WASH is provided in healthcare facilities, and one would think that in most countries, the health sector should be providing, WASH services. But again, we also have the professionals belonging to different ministries, like the water ministry. So we need to look at how budgets are coming from all these existing, ministries into washing healthcare facilities. Today, we will focus on community, national and sub-national levels about how we hold governments accountable and how to ensure that standards and targets are met. Accountability mechanisms help governments and development partners fulfill the promises and commitments they make to development initiatives. Without directed pressure, comparative data, tools to provide insight into successes, failures, and overall results, accountability fails. Accountability is most effective when it is connected across global and national levels. Civil society has a central and independent role. Proactive, immediate, and targeted implementation mechanisms are funded from the start. And advocacy for accountability is combined with local outreach activities. Local and national champions are engaged. Presidents, first ladies, ministers help to draw public attention to government performance. Scorecards are developed to provide insight into performance and highlight the necessary improvements that are needed. And politicians at the district level are supported by national leaders to effect change. Some examples of accountability mechanisms might include accreditation and licensing, incentivization, including rewards and penalties, and citizens accounting and community scorecards. As I indicated, and Lindsay also indicated, the purpose for this roundtable is to have an engagement of all of us to share experiences. But one last comment that I would want to make is that the WASH sector and also the health sector in most countries has been decentralized down to the district level. This has not accompanied the necessary capacity for advocacy to be done at the grassroots level. Take, for example, in Malawi, where we have health committees that are responsible for holding government accountable for monies that are disbursed to healthcare facilities. These people do not have the adequate, training and experience within the WASH sector and the health sector. So this is an area that, as professionals, we have to be looking at, building a lot of capacity. And I know a lot of organizations such as WaterAid and a lot of other, advocacy organizations are building the necessary capacity through, meetings, engagement of media, and also working with other community-based organizations to make sure that people at the grassroots level have a voice, and then they can also hold governments accountable to whatever commitments they've made. So thank you all again for taking the time to attend this important roundtable. And I'll stop here and then hand over to Lindsay to moderate the session. Thank you.
Thank you so much, Brima. And, I want to allow for some questions around the important, framing, overarching approach you've brought to us. So please feel free, if you'd like to put questions in the chat box or raise your hand if you want to make a comment on Dr. Apambere's commentary here. But to start us off, Dr. Apambere, I'm curious, there's two things that really stuck out to me that I think are unique about the WASH and healthcare facilities situation. One of which is your comment about the fact that this is a multi-sectoral issue. And so thinking about accountability, how do we think about this as advocates? Is it that we're approaching both the Ministry of Health and the Ministry of Water to hold each of them accountable? Is there some sort of multi-stakeholder platform within the governments we're encouraging? Curious about your thoughts on best practices with that. And then also thinking about this idea of decentralized governments. Are we also then, in addition to thinking about both the WASH and the health sectors, are we also advocating at both the national and subnational levels simultaneously? I believe you're on mute if you're speaking.
Yeah, so I was muted. Okay. So thanks for the questions. I think, yes, it's, I just think that this parallels with how the history of the WASH, sector itself. And I think we have friends here, John Oldfields and others. We didn't look at just money coming directly into WASH, but what are the other budgets that, contribute to WASH? So for WASH in healthcare facilities, I think most countries have it as the health ministry being the key ministry that is responsible for providing services. But we also have the WASH sector that will have funding that, we can provide services at the healthcare facility. So I think advocacy should be done broadly to look at what are the sources of funding and how can we advocate for those funds, and then also hold those ministries responsible. I look at it when we were doing advocacy, maybe 10, 15 years ago, it became critical that governments, should bring in finance ministers into the table. And because they hold the purse. And so we have to be very strategic about involving all the key stakeholders in the individual countries that, play a role in increasing funding to the sector, not only funding, but also effective programming. And looking at the evidence that we also have to be able to prove that those monies are being used for the purposes that, they were allocated. In terms of decentralization, this is a very important thing that has occurred in developing countries, because many years ago, a lot of things were done at the central government, but governments decentralized, and a lot of this was encouraged by, world organizations such as the World Bank, IMF, and a lot of organizations encourage that because the districts need to own the responsibility. So if you look at Ghana, for example, the health ministry at the district is responsible for, providing services. You look at WASH is the district assembly, but they don't have the capacity. And we as CSOs, NGOs need to build that capacity to create that awareness. An example is when I worked for the Hilton Foundation, we made a lot of grants and working with David Douglas and John Oldfields and others in the US here. We didn't want to just limit advocacy at the US level, but how do we engage NGOs like Water Aid in Ghana, in Mali, in Niger, that will build the grassroots awareness, build, the capacity of the district assemblies. I think it should be a similar approach, and I know organizations like World Vision are still doing this in many countries, but we need to build that capacity because the strongest advocates are the people that this issue affects. And once they are aware of the issue, then they will do the advocacy and then the accountability.
That's great, Brema. We have a couple of questions further for you that I want to bring up. The first of which comes from Maggie Montgomery at the WHO. She's asking, could you provide any specific examples on how national or subnational advocacy has changed programming, increased funding, etc.? And she provides an example of community scorecards in Ghana that are linked with the DHIS2 and provide an important accountability mechanisms that goes beyond community engagement and actually contributes to national change.
Yeah, Well, I'm a bit biased because I'm original from Ghana, but I had examples from Ghana as well. So yeah, so again, and not to dwell so much on water aid, but I've worked with them a lot in the past. But in Ghana, it's very specific now that an example is the district development fund, which has been created. And there was a lot of advocacy around this, where parliamentarians now in Ghana are allocated a certain amount of money every year. And the WAS sector in Ghana has actually advocated very strongly about this. And some of this money is used for WAS services in communities as well as healthcare facilities. But this has to also be looked at carefully because it becomes so political and they provide these services just around elections. But I know that CRS in Ghana, CONEWAS in Ghana, Water Aid, they've had a lot of results out of the advocacy in Ghana in increasing funding in healthcare facilities. And they have mechanisms in place that they also hold government responsible.
That's great. Thank you. We also have a question from Michael Koberlein. Michael, did you want to unmute yourself and ask your question to Dr. Brima? I can see your camera on, but you're still muted if you're trying to speak. There we go. Still can't hear you, unfortunately. No. I'm not sure. It might be an issue. You are unmuted, so I'm not sure what the issue is. If you want to take a second to figure that out, I can come back to you. I'm thinking, Dr. Mpambere, interesting discussion around platforms and opportunities here. We found in working in Cambodia that another version of advocating for accountability was an opportunity to integrate WASH indicators into performance-based financing through a system that the Ministry of Health had set up with partners like the World Bank and other donors. The healthcare facilities were receiving quarterly funding, and WASH became an indicator that they were scored on. And if they did well, they could get additional funding for their healthcare facility. So it was another way to both encourage the financing side of WASH and healthcare facilities while also making sure that these facilities were held up to a certain level of standards. I'll put it back to you. Do you have any other examples or anything else that you'd like to share before we open up for a more broad discussion?
I don't have any examples specifically, but going back to our WASH advocacy, and I see Ellen Walter is also here from RRC. I think that was the evidence-based advocacy that we did, that we had indicators, that if organizations met those targets, then it was an incentive for them to receive additional funding. I applaud that with the WASH in healthcare facilities work, because we all know that even though the WASH sector itself, we as a sector, we still need a lot of funding, but WASH in healthcare facilities is even in a terrible situation. So for incentives to encourage, service provision is very laudable. Yeah.
Great. I'm going to give Michael one last chance here. If you wanted to either type in your question for Dr. Brima, or if you want to try and unmute yourself again. All right, we can always circle back. You're staying on the call the rest of this, right, Brima?
Yes, I'll be around. Yes.
Okay, great. Well, we may come back to you once he's able to sort this out. We definitely want to make sure we hear all the questions. So thank you so much for your contributions, your experiences. I hope you'll continue to participate in the discussion. We are going to move on to the open discussion section of this roundtable. So I'd like to start with just a kickstart question to really get you all thinking and people sharing experiences. So first, we have a poll here. Do you advocate for accountability in your own work for WASH and healthcare facilities? So it should pop up on the screen in front of you. Just take a second to answer. It looks like a lot of people are coming in. And excitingly, it looks like the majority of you are advocating for accountability within WASH and healthcare facilities, which is great news. It means I hope we have a lot of experiences to hear from. I'll give you all just another 15 seconds to respond to the question. All right, let us end the poll there. It looked like 75% of you have said that you have advocated for accountability in your own work. So that's fantastic. I would love to see comments coming through the chat box about your experiences as we go through this discussion, or please feel free to raise your hand and we can go ahead and call upon you to make a verbal comment if you have access to a microphone today. Just a reminder, if you have come in a bit later, please select the interpretation button at the bottom right. You can select a language, English, Spanish, or French. Even if you are listening to this in English, please choose English as your language, as we may have some of the roundtable contributions in another language, and we want to make sure you can hear all of it. So question here to start with, how do we engage with governments to hold them accountable? What are the steps we take? What does that look like? And really, I think there was a great question posed in the chat box from Ellen Walter, thinking about what are these platforms we could use or encourage that bring together the various sectors that are engaged in WASH and healthcare facilities. So I'd like to start off by calling on Lungile Gamere from RHAP in South Africa to kick us off in this discussion. Lungile, are you there?
Hi, yes, I am. Hi, everyone. My name is Lungile Gamete, and I'm from the I think I'll just quickly share, just our experiences as an organization in all of this. And so, last year we had planned a lot of, in-person engagements with healthcare workers through this other project that we have called Voice. So this was to just, create a platform for healthcare workers to share in on whatever challenges they had, either systemically within the healthcare facilities in relation to WASH problems, and also just generally outside of the healthcare facilities, but the things that pertain to the healthcare system in general. And also this Voice project that we have would then show and just highlight various strategies or ways in which the healthcare workers can go about advocating for change of whatever WASH problems that they had noted in the healthcare facilities. But however, we could not really go on with that because of COVID and restrictions. And, even though that really did provide a platform for us to just go back and think more innovatively and, just re-strategize and adapt, and that whole process led us to realizing that, okay, we could then use perhaps a policy brief to continue advocating for WASH in healthcare facilities. So the plan around that involves using our infection prevention control strategic framework in South Africa and linking it to WASH. And this would then, create talking points for us when we meet quarterly. So we mostly work with a district called the OR Tambo district, which is a very predominantly rural district in South Africa. And we last year successfully got to arrange, or not arrange, but we now managed to have an MOU with the district, So we would then, we thought that, okay, this would create a good platform for us to, make engagements with the district and, sit down with them and just, discuss the issues in the district about what issues are there that pertain to WASH or infection prevention and control, and also share what we know also from our end, and then use whatever information that we receive from the district to collectively create this policy brief that we would then use as an advocacy tool to advocate for better WASH in healthcare facilities. So that's where we are as an organization right now. And yeah, we really hope that it will really get on track and we will manage to advocate well. Thank you.
Thank you, Lungjile. And I love, we just talked about this issue of the district approach and more decentralized advocacy. So it's great to hear that that's a big part of the efforts that you're doing in South Africa is identifying the stakeholders at the district level that need to hear this information and engaging, doing broader community engagement as part of the process. So please, as we continue to go on, would love to hear more about the challenges that you faced and kind of learning about others in the same space working at the district level. I do want to open this up as I see a number of questions coming into the chat box, number of comments here. John Barrazo from the GFF here, I see you have quite a comment, and rather than me reading it, perhaps I give you the floor to see if you'd like to make a verbal statement.
Sure. Thanks, Lindsay. I'm not sure what quite a comment means. I'm not sure if that's good or bad, but it's long.
Oh, it's great.
I know.
I just don't want to read it all.
Yeah, I just was, as I was reflecting on some of the things that have been said, I was also thinking about the challenge we always have in terms of holding multiple sectors accountable. And I think that came up. I mean, one of the ways in which this could play out in the this health sector quite effectively is there's a very strong emphasis now on improving the quality of services delivered at the primary level, including for labor and delivery for women. And so one of the areas, and there's two big buckets in quality of care discussions. One is the quality of the provision of care, more on the supply side, but then the other is the experience of care, which has a large impact on demand. So and there's been a lot of work done to try to improve how we measure those, and there's indicators that are emerging as consensus indicators around quality. And as we start to build out how those indicators are actually gathered at country level, it could represent a very useful database for accountability on the experience of care side, especially because experience of care in health facilities is inclusive of the conditions of water, sanitation, and hygiene in those facilities. I mean, we've all probably visited health facilities where the conditions of hygiene have been challenging. And so the way, if we can capture that from women themselves and use that as part of accountability efforts, I think that could actually be quite strong. Now, the place where that's going to happen is going to be at the decentralized level. Maybe some of that's gathered at district level. It's going to even be potentially even more probably also gathered at facilities. And so getting access to that kind of information and using it effectively is really, I think, could be, potentially fruitful line of work. And I had another comment I was just going to put in just to mention that for the Global Financing Facility, we've partnered with the World Bank around the broader issue to advocate the programming for WASH and healthcare facilities as part of country-led efforts. More broadly around the whole space of reproductive, maternal, newborn, child, and adolescent health and nutrition, and that's just a mouthful. But we are going to have the opportunity to talk more about that in the third roundtable. So I'm not going to actually go into much depth on that now. Okay, thanks.
John, before you jump off here, I think your point is really strong here. Thinking about what is the health sector's priorities these days, focus on this issue of experience of care. I wonder how, in terms of this discussion around indicators and monitoring, how do you see, monitoring without any sort of feedback, any sort of outcome from that, some sort of consequence, if you don't meet it or if you do, is just data. What have you seen has been effective in terms of working with governments to use this information in a way to actually hold them accountable and hold these facilities accountable to a certain level of care?
So one of the areas is one focus, not the only focus, but in terms of the health financing agenda of the GFF, it's building off of and building on top of a lot of work that's been done looking at performance-based financing and the incentives that surround that. You know, some of those incentives are personal staff incentives. Some of those incentives are institutional facility level incentives. And you know, I think there's the evidence base is not entirely clear one way or the other. Well, it's not entirely clear that always is going to improve facility quality, facility outcomes. But there are circumstances in which it will. And I think that one of the challenges we all have as people who try to support, we all have at the global level for people trying to support countries in this journey, is to actually be more clear about what tools work in what circumstances. I'm personally never been of the opinion that a tool never works or a tool always works. We actually have to just define when the tool could work. And I do think that there are opportunities to look at the way performance-based incentives, these are, you know, largely financial incentives, can be used to ultimately change behavior. And then the question is, I think the question you raised quite accurately, is that it's not just collecting data. Data is only useful if it's actually used for decision making. And I do think that's one of the areas where, as we look at the challenges of, you know, which are cross sectors at the decentralized level, that we look at those opportunities at that decentralized level to look broadly at the planning functions, the budgeting functions, and the accountability functions, you know, and who are the players and how is that information, how is data turned into information that actually is actionable?
Thanks so much, John. And you brought up a good point that we are doing a webinar in 2 weeks on advocating for financing, and these are all very interlinked. So excited to hear more on that in the next session. And I really appreciate hearing from your perspective as coming from the health sector, because I do think it's going to end up being, in terms of accountability, how do we integrate into this process of how the health sector is already holding its healthcare facilities accountable? So what does that process look like? And it's something that certainly WASH practitioners and WASH experts are going to need to do a lot of learning. And like you said, there's not a one size fits all model, something that health financing is still trying to determine and define. And we can get ourselves caught up in circles talking about accountability and is monitoring accountability and whatnot. But I think, as you said, it's ultimately coming down to what do you do with that information? So I want to address some of the other comments in the chat box. Irene Mungan from UNICEF, I see you have a comment here about accountability to ensure that communities are informed in the planning process and are aware of funding streams as part of this national or subnational projects. And she's asking whether or not there's been examples where this has worked, either from Dr. Brima or from others. Irene, I don't know if you wanted to expand upon that before we open that question up to the audience here, the group here.
Sorry, I was on mute. Good morning, Lindsay, and good morning, everyone. Good afternoon. So no, I was just thinking about accountability on the part of the community when Dr. Bremer was talking, and I think he touched upon several points about accountability to donors, but also other people around us. And I was thinking about how important it is to be accountable to the communities whom we serve and work for and work with, actually. And I thought this is one area that we might want to strengthen. And so I wanted to hear good examples about where governments have and implementing partners have been accountable to the communities, making sure that they actually understand how much funding is coming to their communities, how much is being spent on different projects, and that they don't only understand this information or have this data, but they also contribute to the planning process. They make decisions on budgets and things like that. And once projects are implemented, they're aware of the success and the failures or weaknesses within those projects. And I think this is part of the accountability that we want to make sure that communities are aware of and understand. So I wanted to hear examples of where this has worked, because in most of the communities, I feel that they're probably kind of disempowered. Sometimes they cannot demand for this kind of accountability, and where they try to do so, they're kind of shut down. They don't have a voice probably to articulate their demands to their governments and to people who work in their communities. I wanted to hear, where has it worked, where communities really understand these things and they have all the information at hand to empower them to demand, but also to be part of the planning, budgeting process. Thank you.
Great, thanks, Irene. And great question here about a community engagement as it links to demands and as well as to what we're advocating for in terms of accountability. I give a moment here for folks to type into the chat boxes. If anyone wants to raise their hand and respond back, please feel free. I'll give that a moment here as we think about that. But I did want to, I know Maggie Montgomery from WHO is going to pop off the call in just a minute. And I did want to give a chance for WHO to talk about perhaps both of these pieces, Maggie, both how accountability fits into the 8 practical steps and what you're asking of governments, as well as, step 7, I believe, or step 6 is engaging communities. And so maybe there's something to be said about how those interlink.
Sure. Thanks, Lindsay. And thanks, everyone. This is a really interesting and thought-provoking conversation. So 2 things I just wanted to highlight on the practical steps is, first is those practical steps are now enshrined in the World Health Assembly resolution, which passed in 2019, and all ministries of health. For the first time, we have ministries of health very concretely committing to something quite specific on WASH, which of course is linked to a number of other health agenda items. And as part of that Health Assembly resolution implementation, WHO and UNICEF are monitoring progress on what countries are doing along all of these 8 steps. I just wanted to highlight 3. And earlier in the chat, I put the link to our latest progress report, and you can see where 47 countries are in terms of implementing these steps. But the community engagement is really important. And, we've heard about the community scorecards, and Irene was mentioning their participation, but John was also talking about demand. And this is really important too. So, and it links to the finance, right? Because some services you do have to pay for, and the more demand you have, you could potentially generate more resources for the facility, and it becomes kind of a self-sustaining loop. The community obviously is also really important on upholding their and demanding their rights, and we see that this is important whether you're in a low or in a high income country, about how they should be treated, but also about the basic services that should be there. And I know we've talked about Ghana a lot, but they're also in the process of enshrining in law the right to water and sanitation in healthcare facilities as part of their broader human rights agenda. So I think that's also a really important link that I wanted to make. And then just the last point, and I'll be quiet, is around the quality of care and QI improvement process, which, as John mentioned, a lot of countries are increasingly focused on quality. And often this is also decentralized. So there may be some national indicators, but it's really up to facilities themselves to decide, just like many of us in our own work decide, okay, what are our performance indicators and how are we going to monitor those? And I think that making sure that WASH is part of that, and we're still struggling a bit to have it included often is really important. So those immediately on the ground can better understand and make decisions and advocate to those who are higher up when more resources are needed. So thanks everyone, and back to you, Lindsay.
Thanks so much, Maggie. I know you have to pop off, but I appreciate, again, hearing about this linkage. And I think you make an important point in terms of what are we holding governments to? Those 8 practical steps are not just a document that WHO developed, but it actually is part of the resolution for the World Health Assembly. If you haven't taken a look at that, I believe a colleague of mine will put that in the chat box. But that's certainly something to consider when driving your own advocacy for accountability. I want to turn it over to Ariel Clyde Rabahanta from WaterAid Madagascar, who made a comment. Ariel, if you are able to unmute yourself, do you want to talk about the work that you all are doing for advocacy for accountability in labelizing healthcare facilities as WASH friendly?
Oui, bonjour à tous. Aurel Clyde, chargée de
Yes, hello, everybody. Aurel Clyde. I'm in charge of WASH in Madagascar. Since the past 15 years, we have supported the health minister to convert the health establishment in a WASH-friendly establishment. And so we have trained the medical personnel to make sure that the sanitary installations have WASH capability. And so we have produced manuals for that. And since recently there was a COVID-19, we went to the Senate. We talked to people from the Parliament and National Assembly to express that it was important to add budget for the basic healthcare facilities and make sure that they have a minimum wash, so toilets, sinks, because how can a pregnant woman come to the healthcare facility to give birth with just a bucket of water, which is really like unthinkable. So we are, working on this, pushing, advocating so that the two ministries, health and water, can join their efforts and have some standards that are being respected in the basic healthcare installations and with WASH. And so the last 5 years, we keep pushing with a campaign to really integrate health and WASH. And now we continue this with the COVID-19 because to have 80% of our establishment that don't have a place to wash your hands, it's just unthinkable. So we are really knocking at every door to make sure that we have key messages that are heard by the governments. And last point, when we talk about planning, whether it's at the community level or national, it's important that both parties be present. So those who are there to plan and those who are there to express the needs, because an intervention that doesn't answer the needs of the population doesn't mean anything. And so for that, we continue to push and remind the governments that they must ensure and realize what they have promised to the people and to the community. And thank you.
Thank you, Ariel. And interesting, you're the first person to mention COVID in this discussion, and I include myself in that. And thinking about how does COVID impact our advocacy efforts, and how does COVID impact what we're holding the facilities accountable for. WASH is certainly an integral part of infection prevention and control. So that is extra reason why we need to be pushing to make sure these facilities are held accountable to these standards. I want to turn it over to two others who've made comments and thinking about now at the district level, at the subnational level, what are the elements of success? What are some of the challenges we've seen in terms of advocating for accountability? So Martin Watsisi from IRC WASH, if you're on, and then I'd like to follow that with Sheriff Telly from CRS Ghana. But Martin, could we start with you?
Thank you, Lindsay, and all the contributions that have been made, I think, point quite a lot to the kind of advocacy for accountability at even the sub-district, the sub-national level, at the district level. I will probably share opinion and some experience for IRC here in Kabarole, Uganda, one of the rural districts, where we are implementing WASH in healthcare facilities and trying to advocate for accountability to ensure that the district takes keen interest in promoting WASH in healthcare facilities. Uh, One of the things that we have done is, first of all, to carry out an assessment, largely on government healthcare facilities, um, 30 of them, but included also 10 of which were private. And that assessment of WASH in healthcare facilities was sort of to highlight what the gaps are. And we have used that particular assessment to bring all the stakeholders on the table to discuss the gaps. Um, the awareness of what it should be and the gaps that are existing, I think is very important for all, especially the government, for it to take a keen interest and note where the gaps are. Because earlier along, we were told that government is now taking a keen interest in providing water or accessing water to healthcare facilities. And that meant just a yard tap at a healthcare facility. But you know that is not the standard that is required for a healthcare facility. So the assessment based on the standards that are required for the healthcare facilities was sort of to say, yes, thank you so much for what you have done, but what is supposed to be done is much more than this. And we have engaged up to the district leadership. Unfortunately, when we brought in also the media, I think at some point it backfired on us that when we were using that assessment report, sort of disseminating it, and the media was involved, they only picked one key highlight and said most healthcare facilities in Kabarole do not have toilets. The district chairperson was not pleased with that because yeah, he was also in charge of health and education. Um, but we went ahead to explain that the media picked that because maybe it is something that was newsworthy, but the whole thing is to understand that really you can't have a healthcare facility without a latrine. The advantage is that as IRC, with support from Hilton Foundation, we have constructed a latrine in one of those healthcare facilities that did not have. And the government, the district local government, has also constructed latrines in two others which did not have. Uh, that is sort of like a commitment that they can listen once these things go to the public domain and once the gaps are shown. The other challenge we have is that much of Uganda is and other countries have had like the experiences of Ghana are decentralized. But maybe the service provision is decentralized, the financing is highly centralized for the case of Uganda. So you find that it makes it difficult, especially to bring accountability in terms of how much money is put into healthcare service provision. So I will probably end with the issue of including the health the commitments and to these standards to be known to especially the governments And that can be brought from the point of the healthcare service providers themselves. So we have to ensure that the health workers are aware of what is supposed to be, and they are integrating these kind of WASH needs into the entire healthcare service provision in order for them to demand from the leadership for provisions that would better their services. I think those three for me are very important. One is to ensure that there is proper knowledge of what is required for WASH in healthcare facilities in order for us to demand for it, and also to have the leadership seeing the advocates not as troublemakers, but as people who are trying to solve a problem and trying to help government to better healthcare service provision, as well as also integration of WASH in the entire healthcare service provision. So those are some of the things that we are doing here in Kabarole, Uganda, and I just wanted to put a link to a short video in the chat for those who will find time to watch it as part of our advocacy. Thank you.
Thanks so much, Martin. And it's so interesting also thinking about what you said with the media and the role media plays, because that is certainly a tool that advocates use to draw awareness to a problem, to galvanize communities, to bring in community engagement around this issue, to say, hey, we demand this, this service at our healthcare facility. It is really fascinating to hear how in your case that actually backfired. You've been addressing this through positive reinforcement to say these are good, but we actually need you to do more. And then the media sort of took you back a step. If others want to make comments in the chat box or even raise your hand about how you use media in your advocacy, whether that's been useful to hold facilities or subnational governments accountable, or even the national government, I'd be very interested. Tito, I believe you're on here from Zimbabwe. And I know that recently there was an article about a year ago, I guess, about WASH in healthcare facilities in your newspaper based on the global report. And it was in a Zimbabwean newspaper. Curious if things like that actually facilitate action, or if that is in some ways more detrimental to our efforts. So I have a comment here. It looks like Sheriff Telly actually doesn't have great connectivity. So I just wanted to read aloud some of the comments she was making here. And also commenting here, there's a couple of notes in the chat box about financial transparency, about advocating with finance and accountability. This really does link well to our next session. But Sheriff says, we have been implementing WASH in healthcare facilities since 2017 with infrastructure improvements and behavior change strategies as key. One of the main lessons learned, as already iterated here, was the issue of a reliable and adequate financing. Most government primary health centers find it difficult to continually practice IPC and operations and maintenance, among others, because funding gaps in both the frequency and the amount available for these purposes. As part 2 of the same project, we are looking to scale up advocacy to national and subnational actors to identify responsive funding systems or pools of funding for WASH services, and possibly increasing accountability by ensuring the inclusion of some WASH indicators in existing MIS systems. And so I think that also links back when we think about the this role of financing, but then also what we talked about earlier with performance-based financing and how indicators can actually be part of the accountability system. So I did see a few other comments here. Ruslan, I know you just added to the chat, but interesting to hear from a different geography, thinking about Tajikistan. Did you want to unmute yourself and make a verbal comment and maybe further your question?
Yes, hello colleagues. Thank you, Lindsay. Greetings from Tajikistan. Nice being part of this great roundtable. Yes, so for Tajikistan, we also started working on healthcare facilities and improving access to WASH with UNICEF programming since 2018. And doing the political map, we realized that apart from the Ministry of Health and Social Protection, indeed we have to engage much wider number of stakeholders to make sure that this agenda is taken forward. And so one of the key decision makers in the country that we are now looking on the political map is like when we talk about ministries, the Ministry of Finance, which actually channeling the resources and making sure that relevant departments have access to resources. Then when it comes to the Ministry of Energy and Water Resources, it's a ministry which is responsible for the policy formulation in general in the sector. And when it comes to the point of really governance, it's also a role of presidential administration, and who is also assigning the district chairs to manage also issues at district and at regional level. So, and it would be great to learn from the colleagues what kind of strategies and tactics and also any tools that colleagues are using to really advocate and negotiate with such powerful decision makers to become really supportive for the WASH and healthcare facilities agenda and allocating necessary resources. Thank you.
Ruslan, can I ask, this is a question that just came up from Martin as well around the World Health Assembly resolution and this idea of the country tracker. Martin, your question was how many countries should be part of that? The answer is all of them, because all countries, signed on to this World Health Assembly resolution as part of the 2019 process. And actually 2021 and 2023 are the 2 years that the member states will be reporting back on the resolution as part of that process through the World Health Assembly. So we should see a report out on updates from the resolution in May at the World Health Assembly this year. So Ruslan, I wonder, have these global initiatives, these global push towards WASH and healthcare facilities, the resolution that Tajikistan presumably was one of the member states that signed on to, has that been at all useful in in the work that you all have been doing, or do you think it needs to be more coming from internally from Tajikistan to say that this is something that we need to have done?
Yes, so this is really a good question because again, Tajikistan is joining the global initiatives, but when it comes to the implementation at the country level, so it's becoming really an issue because this process has been facilitated at the country level by WHO, and also even some steps to introduce like WASH fit tools at some pilot healthcare facilities has been introduced. But then it comes to the point of really like ownership and putting these issues forward by the ministry and Ministry of Health. So this is really a work that still sort of like not moving forward. So that is why we really open to discuss such issues with counterparts and partners who are part of this roundtable today.
Thanks, Ruslan. And it's interesting because WASH and healthcare facilities it's not a controversial topic. No one is saying, no, we shouldn't have water in healthcare facilities, right? There's a lot of head nodding when you talk about this. And certainly we know the resolution at the World Health Assembly was unanimously passed. There wasn't even anyone raising their paddle to say, let's discuss this. Everyone said, yes, this is an important issue. And it sounds like, and I don't think you're the only one in this situation where there's a lot of goodwill at the global level, a lot of encouragement to move forward with this. But when it comes to actually moving forward with the implementation, we are seeing stagnation in progress. We're seeing this budgets not being allocated for this issue.
Yes.
We're not seeing an increased pot, not even taking from someone else's budget, but making the pot bigger. And I wish I had the silver bullet to answer that question, but would love to hear as other put into the chat box their similar experiences with this, because I'm sure that this is something others are experiencing. I do see a hand raised, so maybe Ellen, you'll be answering this question and solving this problem for us. Ellen Walter from IRC, do you want to go ahead?
Yeah, yeah. Thanks, Lindsay, for setting me up to answer the question. No, I just have a follow on a little bit to Ruslan's point. I think engagement with the highest level of power and highest level of political decision making at a country, I think, is really important. And Lindsay, I think your point about the global and the influence that the global has on national, I think, it can be used in accountability, that governments have signed up, but a lot of times there's so many competing priorities at a national level, getting this not only in front of them, but creating champions. And so one thing, and Ruslan, I'd love to continue the conversation maybe in the future about engagement with national level, really that political power, I think is creating the champions within the different ministries to advocate towards the higher levels of power. So making sure that the accountability isn't just coming, we'll say, from external partners, but and I mentioned this in the chat earlier, kind of government to government advocacy, and holding government to government accountable in those processes for statements that have been made, whether that be at global or national level, and really trying to drive the priority forward. But Lindsay, as you said, there really isn't quite a silver bullet. I think it can be very complicated, but oftentimes we focus on, or we start the focus on technical ministries and creating coordination and ensuring that's prioritization within the technical ministries. But as we've heard throughout the entire conversation today, ministries of finance and others with really the highest levels of political will and political power are often left out of the discussion. So I appreciate Ruslan's comment and question, and think that there are ways to engage in that. And having a very focused ask. This is with my advocacy hat on. So knowing exactly what is it that is within their sphere of control and what is it that they might be interested, what one specific thing might they be interested in doing that could advance where the sector wants to go with Washington healthcare facilities. So I'll leave it there, but thanks.
Thanks so much, Ellen. And we've got some interesting comments coming in about, exactly about this, Ruslan. What are the things we can do to, hold the governments more accountable to these commitments made? Peter Hines from World Vision making a comment here about the What Women Want survey. For those of you unaware, it's a survey of 1.2 million women that were asked what do they want for quality reproductive and maternal health care. And WASH came in globally at the #2 response of what women want behind compassionate care. And these coming from across the world, though, a number of the surveys were centralized where the White Ribbon Alliance, the group that facilitated the survey, have offices. So I know there were a number of responses in Uganda, for example, Pakistan, but I believe 114 countries were part of this. Peter, I'm curious if you all have used that as part of your advocacy work, or if that's something you're considering in certain countries where you work.
Great. Thanks, Lindsay. It's certainly something we're thinking about. I don't have a great silver bullet example, like you say, to share. But as you were talking about the head nodding experience from lots of people saying, yes, yes, this is a good idea, it just struck in my head to say, well, we actually now have this large amount of survey data that can be used to back up why it's important and to advocate with ministries of health and say, all of your constituents are wanting this, and so we should be pushing it out. So then if that helps to create more momentum and maybe a larger pot of money, and that gets transferred to the district level, then it would be on CSOs and local organizations and health facilities themselves to advocate for additional funding from that pot of money. And so it's a both and, but I think it could be a great tool, and would love to, if anyone starts to go that route, would love to hear how it goes, and if we can, make a more concerted effort amongst those here to do that.
And Peter, that's a great point. And it goes back to something John Barrazo said earlier about this idea of the experience of care, as well as the quality of care. And that in turn impacts where individuals, in this case, women, seek care, which can have a significant impact on user fees and the amount of money a healthcare facility can raise internally, not just what they're allocated from the national government. So I think that that's critical. And to your point, you're almost like drawing a map from what does this survey mean to what this means for policy, and helping as advocates kind of connect the dots there to say, this is why this is important, and what this could mean for things like budgets, as well as the quality of care and ultimately things like health outcomes. So I think that's a great point. Perhaps one of my colleagues can put the What Women Want survey link in the chat box. I know that they are going to be launching, I believe next month, a interactive portal that can share the data from the What Women Want survey, so you can look at it more clearly. We have just a few minutes left here. Michael, I want to circle back to you. I'm so sorry that we couldn't hear you earlier, but you added your question in the chat box, and then we could have Dr. Brima come back on to respond to this. This was, I believe, originally addressed to him. You said, regarding accountability, my proposal would be to learn from the education sector, where WASH indicators for WASH in schools were integrated in a national education management information system. Maybe this could be transferred to a nationally managed HMIS system. Are there, at the healthcare facility levels, are there a way to learn from the three-star approach and adjust for WASH in healthcare facilities? So for the WASH experts, and Brima, you are certainly a WASH expert, are there lessons to be learned here? And do you think that that's an apples to apples comparison?
I think it's a good comparison. The three-star approach in education is a very good approach. And I think there needs to be a study of how this can be replicated or maybe instituted within WASH healthcare facilities. This is very new for all of us, but I think it's a good approach, yes.
Great, and I think that's something that as we compile resources, our team is looking at case studies on WASH and healthcare facilities accountability. So if you have stories of the work that you've done that you would like to share, please feel free to send them our way. We can put our email in the chat box. But something to look about is to think about beyond just explicit work on our rather niche issue, but what are accountability activities that have been undertaken as advocates, both in the health sector. I think, John Barrazo talked a lot about what that could look like with health financing, but then also from the WASH in schools experiences. How do we learn from those as advocates and apply that knowledge towards this process? Because while many of us, it seems, to have lots of experiences with this, we're still learning quite a bit about what's going to make this most effective. I want to turn to one more comment in here. I think it's timely to circle back to COVID. As we think about accountability, and we've mentioned a few times, Jacob Nkwangabote, I don't know if you can unmute yourself, but you've made a great comment here about what COVID has meant in Cameroon for your healthcare facilities. Jacob, are you there?
Thank you, Demi. I'm sorry that I'm joining a little late. Good afternoon, good evening to everyone. In fact, before COVID, we have been in IPC WASH for many years. And after the COVID outbreak, a lot of things we had actually tried to put across, which were either rejected or ignored, a lot of people have come to accept. And there is a natural way of implementing WASH in health facility now, sometimes even without our influence. We actually belong to a network of more than 100 health facilities run by the Cameroon Baptist Convention. And in all our facilities now, we have hand wash facilities at the entrance. And then we also had hand rub in all the work stations. You know, we started using hand rub way back in 2012. And when we were advocating for all the facilities to have hand rub, they said it was too expensive and that many facilities could not afford. So now all the leaders are really advocating for hand rub now. And in fact, we are actually implementing a resolve to save life IPC M&E project now, and we are monitoring 71 facilities. And hand hygiene is one of the indicator that the facilities highly comply to. In all the facilities, compliance was between 90 and 100% right at the beginning in August, meaning that, in fact, WASH has somehow reinforced the message about IPC. It has reinforced the message about hand hygiene. And a lot of things, if we can be able to at least anchor most of our advocacy kind of information around WASH, I am sure that a lot of people are going to understand us easily, because everybody is living the experience and they know that if IPC, WASH, and specifically hand hygiene is very, very important. In one of the coordination meetings that we had, that was in December, most of our leaders, they openly confess to me that a lot of things they had ignored in the past. One of them actually said there was a hand rub container, that is alcohol-based hand rub container that I gave to him more than 3 years ago. He just kept it in his drawer. And it was during the outbreak that he went back and discovered that hand rub in the drawer. And from now henceforth, he always makes sure that he has hand rub on his table. I mean, this was a personal testimony from one of our leaders. So I believe that, I mean, a lot of things that many people had ignored in the past, they actually see the importance now. And this actually is a credit to IPC WASH people, because we can be able now to just anchor most of our messages around WASH. And I believe that in the next 2, 3 to 5 years, I'm sure that a lot of things are going to change. Thank you.
Thank you, Jacob. I mean, great examples coming from Cameroon, and it does, you know, it makes me think about how with COVID, we have this window of opportunity, right? And exactly what you're saying, people really understand the issue right now, something they may not have been willing to prioritize is now coming to the forefront. But simultaneously, we have this challenge where budgets are being extremely stretched. We really need to think about how being efficient with our money because of COVID and what that's meant for the economics, the economy of these countries, whether you're a low middle income country or you're a high income country. So I think it's something we absolutely should be using as part of our messaging, should be taking advantage of this to say, we're in a crisis and you signed on to this World Health Assembly resolution, or you're hearing demand from women, let's make this happen, but also being cognizant that we are going to need to be creative when it comes to how that will be funded and actually achieved. And that links well into our next session. So 2 weeks from today at the same time, we will be having a session on advocating for financing. And really, we've heard a lot about how financing and accountability are kind of integrally linked for Washington healthcare facilities, and certainly beyond, in making sure these development agendas get achieved. So just to summarize what I've heard today, and I love the discussion, the chat box was so active. I'm sorry I couldn't call upon all of you, but I encourage us to continue this discussion. Hearing from Dr. Brahma Apambere about the importance of cross-sectoral approaches to accountability and this advocacy that we're calling for. And Ellen Walter asked a great question about what are the platforms for that? And we didn't really get to dive into that, but I do encourage you to think about what platforms may be available for cross-sectoral work within the government that you can be inserting yourselves into as you advocate for this piece. We heard from a number of partners about the work they're doing at the district level and how with decentralized governments, really we cannot overlook advocacy at that level, and that's really where the implementation starts to take a hold and we start seeing action. We heard about, again, about financing and the link to performance-based financing, and then also linking this to other key issues in the health sector, quality of care, maternal and newborn health. I do want to, again, circle back the World Health Assembly resolution. If you haven't taken a look, those are very similar to the language used in the 8 practical steps. It is what essentially codifies it. And we think we'll be thinking of this as it comes to the World Health Assembly resolution, the World Health Assembly in May of this year, where we'll be hearing reports back from countries on progress. Similarly, the country tracker in that December report. Lastly, really exciting to hear about some of the experiences from Madagascar and Ghana, from Tajikistan, about the advocacy that's starting and some of the lessons learned, like perhaps caution around how you use the media in your work to hold countries accountable to this. So I encourage you all to continue this discussion. We'll certainly be talking about it from our side. As I mentioned, we are developing an accountability case studies document for Washington healthcare facilities that grapples with these issues. I think the question from Ruslan about how do you help make these powerful leaders take action on this? So if you have examples, Haley put her email in the chat box, so please feel free to send us a note. I'm going to hand it back to Danielle to close us out, and thank you again for being such a lively discussion.
Thank you, Lindsay. This was a great discussion, and I hope everyone feels the same way. Thank you to Dr. Brima, as well as our other speakers and everyone else who chimed in with questions, comments, and just overall thoughts on the issue of accountability. As we've mentioned throughout today's webinar, our last in this discussion in this series will be in 2 weeks on March 17th. And this one is focusing specifically on advocating for financing. And we have some great speakers lined up for that. I do want to note for that webinar, if you are in any country but the United States, this webinar will be at the same time. The United States will move their clocks forward for daylight saving time. So it will start a little bit later that day. So we get to sleep in a little bit more that day. So it will start at 8 a.m. on the East Coast of the United States. We hope you will join us in 2 weeks. We're looking forward to that discussion as well. Thank you again, and we will send out a follow-up email with some of the documents and links that have been shared in the chat box, as well as links to the recordings in a few days. Thank you very much, everyone.